Today we will discuss about the most common and important thing, PCOD or PCOS. This PCOS and PCOD is the most common terms heard today, especially among the young women. But unfortunately, it is also one of the most commonly misunderstood conditions. Many women come to me worried, Doctor, will I ever have regular periods? Will I be able to conceive? Is this a lifelong problem? Today in this video, I want to explain about PCOD and PCOS clearly, calmly and scientifically. Not to scare you, but to help you understand your body better. So let us begin by understanding what PCOD and PCOS actually means. What is PCOD? PCOD and PCOS are the hormonal conditions where the ovaries do not release eggs regularly. Normally, every month the ovary releases one mature egg. In this condition, PCOS, the process becomes irregular. Because ovulation does not happen properly, the hormones get imbalanced and mature small follicles can be seen in the ovaries. PCOD is a milder and more common form, whereas PCOS is a more metabolic and hormonal condition. Both are manageable and both are not life-threatening conditions. The key problem here is hormonal imbalance, not a damage to the ovary. PCOD does not happen due to one single reason. It usually develops due to a combination of factors. One of the major factors is insulin resistance. When the body does not use insulin properly, insulin level increases, which affects the ovarian hormones. And then second important factor is genetics. If your mother or sister has PCOS, the chances are slightly higher. Lifestyle factors also play a big role. Irregular sleep, stress, lack of exercise, weight gain, and unhealthy eating habits. So PCOD or PCOS is not your fault, it's your body reacting to internal and external factors. The common symptoms that women experience during PCOD are, they present differently in different women. Some women have irregular or delayed periods. Some experience weight gain, especially around the abdomen. Acne, oily skin, excessive facial or body hair, and hair thinning are also the common symptoms. Some women face difficulty in conceiving while others may conceive naturally. It is important to remember having one or two symptoms does not actually mean PCOS. Diagnosis is always based on history, examination, blood test, and ultrasound, not just symptoms alone. Now we will see how PCOS or PCOD is diagnosed. PCOD or PCOS is diagnosed not based on ultrasound alone. Ultrasound only shows the ovarian appearance. Hormonal blood tests help us understand the internal imbalance. We also assess the menstrual history, weight changes, skin symptoms, and metabolic health. Many women panic after seeing PCOD written on a sonography report, but ultrasound findings without symptoms do not always require treatment. Diagnosis should be done by the doctors, not by reports alone. Now, the most important thing we are seeing, many of us are interested to know the fertility status and PCOS and PCOD. This is the biggest concern for most of the women. Yes, PCOD or PCOS can affect ovulation, which may make conception difficult. But the good news is most women with PCOD or PCOS can conceive with proper guidance. Sometimes lifestyle changes alone are just enough. In some cases, ovulation-inducing medicines are needed. PCOS does not mean infertility. It only means ovulation needs support. With timely treatment, pregnancy outcomes are usually very good. So, what are the long-term health risks associated with PCOS? If PCOD or PCOS is ignored, it can lead to long-term problems. It includes type 2 diabetes, high cholesterol, high blood pressure, and weight-related issues. Irregular periods for many years can also affect the uterine lining. That is why PCOD or PCOS is not just a gynecological condition. It is also a metabolic condition, meaning it needs to be treated. Early management helps to prevent future complications. The treatment approach, what actually helps is, for PCOD and PCOS, treatment is always personalized. There is no single tablet that cures PCOS forever. If lifestyle modification is the foundation, regular physical activity, balanced diet, adequate sleep, and stress management are most important. Weight reduction, even by 5 to 10%, can significantly improve the hormonal balance. Medicines are prescribed based on the symptoms for cycle regulation, acne, insulin resistance, or fertility planning. Treatment goal changes with the age and life stage. What is needed at 20 may not be needed at 30 years. PCOS management is about balance, not suppression. Let me clear some of the myths and common fears associated with PCOS. PCOS or PCOD does not mean you will never get pregnant. It does not mean lifelong medication is compulsory. It does not mean surgery is needed. It's not a curse. It's a condition that responds very well to consistent care. Internet advice and comparison with others only increases anxiety. Your body is unique and your treatment should be too. Now, the take home message is PCOD or PCOS is a common, manageable, and treatable condition. It does not define your femininity, fertility, or future. Understanding your body, making sustainable lifestyle changes, and following medical guidance can help you live a completely healthy life. Do not panic, do not self diagnose, and do not delay care. PCOD or PCOS is not something to fear, it is something to understand and manage.